I'd like to introduce our keynote speaker, which I'm very excited. You know, bigger travel. I know that Tara talked about her travel experience, which was across the ferry, but Jackie Qatalina Schaeffer, who is the Inupiaq. We talked about this funny language that we share in terms of our consonants and vowels, who comes from Kotzebue, Alaska, and is the director of climate initiatives program at the Alaska Native Tribal Health Consortium. So for decades, she's worked across Alaska holistically infusing Indigenous knowledge into a variety of sectors that she has experience in, including comprehensive planning, energy, housing, water security, sanitation, and climate change adaptation for rural communities. Her current work includes leading a team of the Center of Climate and Health and the Center for Environmentally Threatened Communities within the Climate Initiatives Program. So I think this keynote this morning will really bring together some themes that folks were talking about around climate sensitive hazards and where we look for emerging and future threats, but also a different worldview of thinking and bringing in Indigenous knowledge into community resilience. So I won't say any more to steal time and topic. I would love to turn it over to Jackie. Please join me in welcoming Jackie up here.
It's working now. All right. Thank you so much. Okay. Oops, that's my mic. Get you going. I want to make sure this works because I move my hands a lot. Does it sound good? Yeah? Okay. Uvla lota, Vanga Atika Qatalina, Nalagmichiska Jackie Schaeffer. Good morning in my Inupiaq language. I'm Jackie Qatalina Schaeffer. Let's see if this is going to work for me. I'm the director of climate initiatives at the Alaska Native Tribal Health Consortium. I'm going to give my full introduction in Inupiaq, and then I'll explain why we do this, right? So, Vangatika Qatalina, Inupain Runga, Anirunga Kikitagrumi, Anayakaka Makiklu, Kipkinyalu, Atataga, Igluglu, Aguchuklu, Mayaklu, Floydlu. I'm Inupiaq. I'm from the community of Kikitagruk, which is Kotzebue. It's a Russian name given to us after the fact. But Kikitagruk is on the northwest coast of Alaska. And Inupiaq of Alaska, also the Inuit Nunat goes all through northern Canada, Greenland, and Russia. We have the same language base. We are the keepers of the Arctic. We are the protectors of the frozen north that is the balancer of the entire planet's heating system, cooling system. If your air conditioner goes out and you're in the south, then you have an issue, right? If you're in the desert and it's 120 degrees and your air conditioning goes out and your car breaks down, you're in trouble, right? Well, we have to start thinking through that lens because the Arctic is our cooling system. So I was born and raised in Kikitagruk in a time of change. So I was the first generation in my family to graduate from a high school locally. My parents, my aunts and uncles, my grandparents all were shipped away to boarding school. So I like to say we were probably the last Americans colonized, right? And it's still happening. The systems in place haven't been changed. And so we have struggles every day, but we face them through this new lens of looking at worldviews and finding ways to integrate, if not integrate, then walk side by side to make sure the outcomes are equitable and the outcomes are more positive than what my parents and my aunts and uncles saw. And so this is a little snapshot of me in time. I grew up on that beach up there in the top center picture. That gravel beach was our community center place where we did all our subsistence harvesting. For those of you who don't know, in Alaska, we have a subsistence harvest, and all Alaskans get to do it, not just Indigenous people. So you get to fish and get your food for free. You get to hunt and get your meat for free. You get to harvest berries and greens and plants as food and medicine for free, but you have to take care of it in order for it to come back. And so there's a sustainable knowledge system that's been there for thousands and thousands of years because I still eat the same foods that my ancestors ate. And we're seeing a lot of change. So that beach is no longer there. There's a 20-foot seawall that has been compromised many times by sea storms. So that tells you how much the water is rising. This is important because I just turned 60, and in my 60 years of life, we've seen immense climate disparities in our region. And you can see the flooding down below. That's the steps of a school in Norton Sound in one of the communities during Merbok. And if you don't know about Merbok, Merbok was a typhoon that hopscotched over the Aleutian chain and hit a hot pocket of water and reaccelerated and hit the coast of Alaska, causing extensive damage. The response systems in place, including FEMA and EPA, were not ready for that. We don't have typhoons in Alaska, but it happened. And the things that washed away were the things that meant everything to our people. Our fish camps where we harvest our foods. So food security was at risk in a different lens for our federal partners. So we had to educate them, and we had to find new ways to respond. So this is Qeqertalik. You can see on the map how close we are to Russia. Kotzebue was in a sound, a very large, shallow sound, with two big freshwater rivers that feed that sound. So we have the ocean, the sound, and then we have the Kobuk River and the Noatak River that push fresh water into that. So we have this unique ecosystem. We have this brackish water where the fish love to feed. The little fish love to feed because it stirs up all those little particles. And then the little fish get eaten by big fish, by seals, by whatever, right? So there's your food chain. We get 80% of our foods from that sound. And when that's being compromised, 80% of your food security, if you went home and 80% of your food was gone, you would be concerned. What would be left? And so we ask these questions through this lens. My family has harvested at our fish camp, for thousands of years. Scientifically, they say 500 generations, but still in the same geographic space on the planet for 500 generations. My grandparents, if they were alive, would balk that and say, no, it's been longer than that. But these are just photos of our life today, how we've integrated into our current world in our Western societal structure, but maintain those value systems and those traditional ways of living. So I had a very traditional Indigenous life because, yes, I went to school, but they were flexible because it was the first time they were having school in our community. So we lived out on the land at our fish camp from usually before the ice melted in the spring. So usually March or April or May, depending on the weather. And then we came back before it froze, so October-ish. So we spent more time on the land than we did in the community. And so all of that led to many different things. But after high school, I jet setted to London to study fashion. We got Glamour magazine and I was sold. And you wouldn't think that design has anything to do with our world today, but design is simply a form of art. It's a creative way of thinking, and it allows you to see the world through a different lens. And indigenously, I had been doing that my whole life. I'd been skin sewing. I'd been making clothing to keep my kids warm. I'd been, after college, obviously, but I grew up in that environment. So everything had a reason. But now I got to take it and look at it through this Western lens and blow it up. But what I was able to do is instill those value systems and bring them to London with me and share with students that had never, we were just a fantasy Eskimos in a cartoon, right? It wasn't real to them. We weren't real. We were a fantasy. And so I realized at a very young age that there was something wrong with this way of living because we're real and we still live the same way our ancestors did. And our elders say, now you've mastered their ways, but you still have your ways. They can't know your ways or master your ways because they don't live there. So we have to make sure we share because you only know what you know until you know, right? So we have to make sure we have this knowledge sharing and we share our worldview because those value systems instilled are what take me to my current job. So we still pick our berries. I still design. Fashion design's like my side job. We grew up with reindeer. You wouldn't think in the Arctic that you would have things that really, when I talk about it now, I love horses because we herded our reindeer with horses. So I grew up with 10 Icelandic horses and 2 Morgans above the Arctic Circle, herding reindeer. Never imagined that nobody else lived that way. I just assumed that we were in this world together and it was all the same. But that's not the case. And most people would argue with me back in the 80s that horses can't survive in the Arctic, but they did. So it's really important to understand your journey, right? Your journey to this moment in time. So we still collect our plants as food and medicine. This is another thread. We're talking about threads. Communication, right? We have a Western healthcare system that's very prescriptive. There is nothing wrong with that, but we have issues with it now because it's driven by money. It's a financial game, right? But we also have traditional methods of healing that have been around for thousands and thousands of years that most of the Western medicine is somehow connected to somebody saw something and thought they could replicate it in a higher, in a more, rapid fashion, right? But we still use these plants as food and medicine. And I'm going to show a few slides later. The climate and health piece is really important to me because these are the elements where we then could build our knowledge systems both ways, right? And especially across tribal nations. So if there's tribal nations in the room, this is where then we get to look at the similarities and we get to look at, because everybody was impacted differently, what we lost and what we could relearn. I like to say every season has a reason in our world. If I were in Alaska and asked what season it was, they would say moose hunting season. We just got over salmon fishing season. So every season's not seasonal, summer, fall, winter, spring, because in Alaska and in the Arctic, we have in-between seasons. We have seasons that shelf those other seasons in a Western context. And those shelf seasons are our most destructive seasons for Western infrastructure. Not for us culturally, but for Western infrastructure. This is where we get the spring and the late spring thaws and rotten ice that cause safety issues because we're using Western infrastructure. The fall shelf season is where we get those storms, like the Merbok, if there's a hot pocket of water somewhere down south. So we have to pay attention to these seasons. But for us, culturally, every season has a reason because it's connected to food. And so this becomes the climate and health thread that is so important to us. So I work for the Alaska Native Tribal Health Consortium. I have staff here. I'm not going to be able to stay because I have to fly south, but raise your hand if you're ANTHC staff. They are well-versed in all of this as well. And so the Tribal Health Consortium is our statewide tribal health network. It's very unique. We have pushed the boundaries and created some very unique approaches to healthcare. And our vision is bold. The Alaska Native people are the healthiest people in the world. That is a bold vision. That is a bold statement. But we wear that hat every day when we show up at work, and it inspires us to do creative things. This is a snapshot from our unmet needs report, which I have some summaries here that I'll leave. I'll also pull up the QR code to the entire report. But understanding Alaska is very large over the United States. But I like the image of it over Europe because that's the diversity of our indigenous cultures. We have 11 distinct cultures in Alaska and over 200 language dialects in one state. It's very different than anywhere else. We have frozen Arctic tundra to temperate rainforests and everything in between. So when you're looking at response, it's very site-specific and regionally specific. So we have to be creative and we have to understand it. We also have most of our communities that are off the road system. They're fly-in communities only, And each region has a hub. So the hub community is usually the larger community, and then it's scattered with villages around that hub. And so you get to the hub, maybe on an Alaska Airlines jet, 737. But when you get to that community, you have to get on a smaller plane, usually a 206, 207, or a Caravan to get to the village. This is the lifeline for everything Western. All the food, all the materials. We have barge service only in the summer. So your construction season and recovery season is very limited. We are embedded in our organization. We have 4 core pillars at ANTHC, and we're all about acronyms. So you'll see all our acronyms, but if you have any questions about what they mean, you could ask that. So we have 4 main support services. Our support services is important because it's not just IT, it's our telehealth, because we are off the road system. We had to create something to get access to healthcare providers if they couldn't fly out because of weather or other constraints. We have our Division of Environmental Health and Engineering, which both James's emergency preparedness team as well as climate initiatives reside in. And then we have Community Health Services, which is our preventative arm, and they handle all of that preventative medicine, as well as our epicenter and our research arm. And then we have our Alaska Native Medical Center, which is the statewide tribal health medical center. So one of the big things about climate initiatives is knowledge sharing, is really understanding everything about the work we do and the people we serve, and then sharing that knowledge and really finding those threads that connect us. What else can we do that somebody is doing somewhere else, and how could we use that thread to help build what we're doing? We house the Center for Climate and Health, and we have the manager, Sarah Yoder, here. And then we also have the Center for Environmentally Threatened Communities that really is the response arm and that research arm that says, okay, what are we dealing with? So they produce, they work with communities, and they also produce reports. So the Center for Climate and Health houses all of these different things. Again, acronyms. LEO stands for Local Environmental Observer Network. And so this is where then our local observers could get on their phone if they see something unusual. We have a lot of permafrost melt in the Arctic right now, very unusual things happening to the planet. And we don't understand it, and science doesn't fully understand it. So we have to start tracking these things. And how do we do that? So finding platforms that allow us and allow people who are living in those spaces to report them so that we could connect them to science and research and really start to understand what's happening is vitally important. Otherwise, we can't come up with applicable response systems. So we do a lot in this program. I'm going to highlight some things, but if you have more questions, please talk to Sarah and Abby. They're both here. These are some core things that we're currently working on. Food sovereignty and housing came up in a statewide landscape assessment that we did to really understand what are we dealing with. And so that was not what we thought we'd hear, because most communities are threatened in ways that infrastructure is being threatened. So usually the response is, do we protect in place? Do we do a managed retreat? Or do we fully relocate, right? So we're looking at these elements like permafrost melt, erosion, flooding, extreme storms, and then usually helping a community decide what of those 3 are they going to do. What we didn't think we'd hear is that we have a huge housing issue that's causing health disparities. And we have a huge threat to our food sovereignty, which is our food security, because even I have 80% of my food comes from the land, air, and sea. And so even me, who lives away from my community, if that food is threatened, my cupboards are threatened, my freezers are threatened. So my food security is threatened. So I'm not going to go into these. Most of you know this One Health framework, but the thing is, in Alaska, it's very unique because we have these cultural elements that make those threads a little bit bigger. So that food sovereignty piece is critical to our health of our Indigenous people. And if our vision is that they're the healthiest people in the world, we got to pay attention to that thread. Our impacts to food sovereignty, There's a list here, but I want you to look closely. I know it looks like water with a bunch of fish in it. It's not fish. Those are whale bones that are holding the soil out for a food cellar that's supposed to be not filled with water, but just like an ice chest in the earth. And those are being threatened. We have the Center for Environment Threatened Communities. Again, we do a lot of different things. These folks are now the technical arm for the infrastructure piece for response. So we have a risk assessment program that's building out with experts that are looking at data, working with organizations like the National Weather Service, NOAA, all of those agencies that collect data, putting them together and helping communities have the right information to make informed decisions. How do you make an informed decision if you don't have information? If all you know is that that land right there is disappearing, so we better move, right? But maybe it's not going to do it again, but we don't know unless we have information. And so really just looking at that, helping communities, empowering leadership to ask those questions. Our tribal people are very humble. I am a talker. I didn't get my voice till I was 40. They nod their head, do their shoulders, maybe their eyebrows, maybe they smile. They might not necessarily be digesting and understanding the information being shared with them. So we have to sit back far enough to say, okay, tell me what you just heard. How does it make you feel? Is it going to help you make a better decision? So communication is critical here. And not just talking, listening, active listening, and then really having that discussion of, is it really being instilled in a way that is going to be helpful and useful? Or are we just talking at people, right? So this is what they're currently working on. We have the risk assessment program feeds into, so this is kind of how we look at it holistically. So we have these threats, the risk assessment programs collecting that information so we can say, okay, what is the risk here and what is the threat? We pass it on to the planning team that says, okay, these are some options for planning for this community. Bring them to the community, let the community look at them, let them engage, and then let's go find the money. Let's find the money so that this community is empowered to create that change. And then they can make that informed decision because now they know our threat is high, our risk is high. We know we don't have the technical expertise, so we need lots of help. So we need experts to help us plan. We know it's going to cost $60 million to relocate. Who's going to give us that money? Nobody. There is no funding flow in that. So now to make an informed decision, could we mitigate in place for the next 50 years and just hopscotch away from danger and cost 30 million? Or do we fully relocate for 60 million? Now you have information to make an informed decision, right? So it's really about empowering people. Here are our current trends. There's always a ripple effect in nature. And the ripple effect is not necessarily negative unless you're constrained to a location and you have hard Western infrastructure that costs millions of dollars that is going to be damaged. So the burden falls on community. So how do we make sure we empower community to have the information to look at all of these ripple effects, right? And then here's the QR code for the publication. You could get the full publication online. If you have questions, we have our email address there. We have staff in the room. Please don't hesitate to ask. Of course, this report was written over a 2.5-year period, and the economics behind it was totally different in that time frame because COVID happened and the supply line went away and then the prices went up. And so a lot of these estimates are probably close to double now because of things that happen outside our control, right? So if you have a barge system that only comes in the summer, and you have funding that only covers the first half of your design phase, you cannot, in rural Alaska, leave a half-built building through a winter in Alaska. And we were talking about cold and heat extremes yesterday. I have a great example of a community in the interior of Alaska. And in February, when I was there with staff, it was negative 70 Fahrenheit ambient temperature. We took a snow machine across the river to another village. And I said, okay, we're not going over 20 miles an hour. And they said, why? And I said, because what's the wind chill at 20 miles an hour at 70 below? Does anybody know? Negative 150. And so this young lady was from, she's in Colorado now, but she was up there as an intern. She was like, it doesn't seem humanly possible. How do people live here? Well, sent her back out in August. And in that same village, it was 100 degrees in the summer. So your temperature variance, negative 70 to 100 degrees, you're engineering for this. Your health response is for this. So you get both. I know. Sorry. Doesn't understand me ever. But it really is like that's the challenge, right? So when you're faced with a challenge in this setting, you either learn more so you could respond differently. You ask lots of questions so you could figure out, but it also gives you this creative space, which is where my design mind goes, right? If it doesn't exist, how do we create it? How do we evolve with these issues so that we're in the same rhythm as nature? So that if nature's going to change, we're going to change too. We have to step out of this Western confined structure of this is what we do 8 to 5 every day. And then that little window of in nature for the weekend, right? We have to blow that up. All right, so we started with this landscape assessment because my program was funded by NOAA, and it was really, let's step into that space with NOAA. NOAA had leadership at the time that was curious, creative, and they wanted to know. So we said, okay, we'll do it together. But we can't respond until we know what we're dealing with. So it takes, in Alaska, communication, appropriate communication, and relationship building. Relationship building's hard, right? Building trust with people, if the turnaround is fast, is very difficult because you have to have this human-to-human interaction. And so the psychology of it becomes more important than anything. If I'm going to only know you for today, how do I connect? And how do we remember? You have to get to that human level of psychology so that you impact people in their space, right? Meet them where they're at. So what we found out is we had very little knowledge beyond our statewide system. When we went to the regional level, very little. When we went to community level, almost nothing. They either hopscotch to the state or they go straight to the feds. What do we do? So Alaska's unique. I just told you this whole story. How could somebody in Washington, D.C. or Arizona even communicate in the appropriate way with somebody in Alakakit, where the weather variance is at, and they're Dene, but they're not same Dene as down there. They have their own culture. They have their own ways of living. They've survived there for thousands of years. Some engineer from Arizona is not going to understand how to respond. So we have to make sure we do this knowledge sharing. So we had a tribal gathering across the state of Alaska. We brought all our regions in to meet with feds, to meet with the state, to really just share their stories, their realities of what's happening in their communities. And it was amazing. And I would say with all those feds that probably most of them are no longer Fed employees, we're still in contact because the impact was so great because it was personal. We got another round of funding from NOAA as part of their Climate Resilience Regional Challenge. And this was our theme. We're stronger together. We could do this if we work together. And so we applied for a very large amount of money and we got it all. And they said, do what you're doing. So the flexibility in that is that we get to create things that don't exist. But we need everybody. We need all the experts in the room to share their threads because we're creating a tapestry that's really ugly right now, but when we flip it over, it's going to be really cool, right? Well, that's our hope. This is the impact that one grant is going to have. across the state of Alaska, that's almost the size of the United States, right? So it's huge. Our hope is to utilize our statewide tribal health network, which is a kind of a hub and spoke, and utilize that network that's already in place to build resilience, to build knowledge, to build response systems that are closer to the impact. Right? And this is our goal, is not to say we're from the government, we're here to help, to step back and hold that blanket that's going to toss that community into the air and say, go, be empowered and rise above it all and make the change that you want to see for your community. And so that's really, really important. I'm going to loop back to a dear mentor of mine. Our traditional healers in Alaska were pretty much nearly abolished during colonization. They're slowly rising back up. Dr. Rita Blumenstein was a traditional healer, a Yupik woman who had delivered thousands of babies in villages across the state because her husband was National Guard, and she followed him and just used her traditional methods wherever she went. So her imprint in our state was huge. She was like, we could do this. We could do this. And if we just keep doing it and revitalizing it, this will be normalized and we'll be able to integrate it into the systems. Like when COVID cut everybody off, some villages shut down their runways. They had no contact. They went 100% traditional medicines until that vaccine plane landed. And then they came to the airport and got the shots, and then they did their. So it's really important to understand that these are things that will help everyone. They will help small demographics within a big city. If you have, certain areas, pockets that work very well together, rise them up. Let them help the ones next to them, right? So this is really important because if we don't have a healthy planet, we won't have healthy people. We don't have planet B. We don't have it. So we have to look at it through that lens. I think that's all I have. And I think we have time, yeah? Okay.
I know folks have got questions. Thank you for making time for your remarks.
Yeah.
Building.
Thank you. Thank you for your presentation. My name is Buck Jones, I'm Road Cayuse Trouble Member with Columbia River Inter-Tribal Fish Commission. I appreciate your presentation. Tribal food sovereignty is really important to our tribal people too. I was wondering if you could talk about the resource management and how the state is impacting overcatch and bycatch of salmon, and how it's how some of your people are unable to now to even have subsistence fish in the systems, and how that has really, I think the trawlers have caught salmon, and it's impacted historic runs that are little or nothing now. So I know it's really a large issue, and if you could expand on that a little bit, I'd appreciate that. Thank you.
Yeah. So we have the Yukon River goes from the coast of Alaska all the way up into Canada. That river, the fisheries has completely collapsed. They have a 7-year pause on all fisheries on that river, but our people in Alaska on the Yukon River haven't had fish for 4 years. This is huge to not only culture, but their food security, as well as traditional pathways into the future. So most of our history is still oral. Most of our traditions are still taught hands-on. And if you don't have the fish to teach, you're creating generational gaps, right? We saw this in Cordova with the Exxon Valdez spill. The response took so long, the recovery took so long. They had a generational gap in their traditional ways of teaching. And so they realize that. So now we're looking at that very closely, because it's not just the food security and the fish collapse. And I would say, yes, we have outside trawlers that come from big commercial fisheries, right? And there are different zones. And there is this one zone that seems to be really impacting the Yukon River. So the management is still a struggle. There still aren't enough Indigenous voices to share that knowledge. The Board of Fisheries is still very Western centric. So the decision-making is still very imbalanced. But what our elders are seeing is an imbalance of fish. Fish are not going to go completely away unless they're, completely, all regions are impacted, right? So what we have are no boom pockets in Alaska, in areas that are not necessarily, that nobody puts a tag on every fish and knows that that was a Yukon River fish, right? And this is a Kuskokwim River fish. And this is a Bristol Bay fish. This is the Copper River fish. All we know is that fish in the Copper River region are changing. And the reason is there's an imbalance of their home, right? So they've migrated to other areas and then been overfished. And so what's the solution there? To instill some of this knowledge sharing and put more Indigenous people that are being impacted on those border fisheries. It's not easy. Those are heated discussions that are emotional and they're ugly. Yeah. So I don't know what the solution is. All I know is that listening to the elders now is they're looking at those systems. That's one system of one species. Well, there's five different kinds of salmon, but if you group them all together, that is the fisheries is one group that is being impacted in ways that we truly don't understand. Not an easy one to answer, but thank you. Anyone else? That means I did my job right. I shared enough. That's a lot of information. Okay. I think we're good.
We've got to get ready for, the academic.
I got all kinds of things about talk
So-
about that.
Hopefully this is your question. Can you talk a little bit more about the challenges to those communities if the decision is to completely relocate? I imagine that becomes a pivoting point that many of the members of the community decide to go elsewhere and not move as a mass. And what does that do to the sustainability of that community?
So our community average population is around 250. We just had our first full relocation in this type of structure. The community of Newtalk moved across the river to an island that is volcanic rock, Schaeffer, to the community of Makhtavik. And that Yupik village, it took decades, but the press against time created some very negative outcomes, because when you hurry, you usually make mistakes, right? And so that community, though, lessons learned from that community relocation is they decided to relocate, and then they went back and forth for about a decade because the word relocation cut off all federal funding for any kind of services. So you're going to move, we're not going to invest. But they're not moving yet. They don't have the money. So then that created a whole different dialogue, right? So you came up with words like mitigate in place. So you tried to change the language so it was a little more palatable. That community ended up having an influx of funding from the federal government that moved 25% of their people to the new location that had no school, that had no healthcare system, that didn't even have a runway. So they were separated as a community, as families. This is a small community. Everybody's related to everybody. Grandparents on this side, kids on that side. Kids have to go back and forth, risking their lives to go to school. They started a pioneer school, so then they didn't have to do that, but they didn't have a gym. And sports in Alaska is huge, but they had to do the same thing, risk their lives to go to the gym to play basketball. had another influx of funding, brought more people over. The housing was an issue because it takes a long time because you have these seasonal disruptions, right? Stop, go, not effective for federal dollars because every grant has a timeline. And so it's not easy. It's ugly and it's not perfect. And right now, thank goodness they've all moved, but we have a contaminated site that has to be cleaned up because there's all kinds of waste there. This community had never been served with water and sanitation. So their human waste is in that spot. The thing about data now is we could look from above and see these hot spots of what humans impact to the earth is. And that's a good example. You see things happening that we're going to start seeing that all over the globe, right? But we're starting to see imprints that will help us understand that. But that is not an easy decision. One, it took a decade for them to finally say, you know what, let's just do it because our people are going to be washed away. I was out there, the last time I was out there 2 Septembers ago, the water was up to the school doorstep. So that summer they decommissioned that first half of the school and just like tore down the first front of the school and just had the back half of the school. I mean, like that is not one, we don't know what the mental health of those children having to grow up in that. We're not going to see those results until they become adults. That trauma is layered on top of colonization, language disruption, food disruption, climate disruption, all these things. And those kids live through it. So you're going to have some resilience threads, but you're going to have trauma. You're going to have trauma threads. So yeah, it's not easy. And there is no, we went backwards in our funding mechanisms. So right now there is no funding mechanism for that. Yeah. And you cut me off whenever.
Jackie, you were talking about New Talk. I think for this audience, the issue of the tiny homes might be really interesting of how a temporary solution can easily become a really bad permanent solution.
Yeah. So one of the issues with housing with the community of New Talk, because they were rushing, is they couldn't build houses fast enough to save all the people, right? So they put in these tiny homes, which were a thing of America, right? They're like the flash in the pan. Let's put tiny homes out there temporarily. Well, we knew from our history that there is no such thing as temporary in rural Alaska. It becomes permanent. FEMA response housing, temporary housing becomes permanent housing, really bad health outcomes, right? Moldy, I mean, overcrowded. Humans put off a lot of moisture and heat and stuff. And so in a confined space that's overcrowded, the building science of that structure is compromised from the get-go. So what we have are families of 8 or 10 living in a tiny home that has a loft for sleeping area. In the first year, the first winter, it's overcrowded. They have nowhere for their stuff. They're seasonal. So they probably have, I would say 8 seasons in that region, right? With 10 people, you have clothing, equipment, hunting equipment, fishing equipment. Where are you putting all your stuff? Well, when they left their 3-bedroom house in New Talk, they just left their stuff there because they didn't have room in this tiny house. So they just brought the people and your clothing on your back, right? That's still there a year later. Now they're going to decommission this side of the community and they're making plans. And the people are like, wait a minute, my stuff is still in that house. You can't tear it down. And there is no solution for that. There's no mechanism in place. Nobody has thought about that in that broadness. And so these are the challenges that we face, not only the housing issue, but the link to negative health outcomes. The lack of mental health response for those layers of trauma that that family is facing. Mind you, I speak about this and it's the community health aide. It's her family. And she's supposed to help the community stay healthy. She can't even keep her family healthy. So it is, it's a conundrum. But If this is the first example, let's learn from it and let's not do it again. Yeah.
Well, thank you so much.
Yeah.
I really appreciate you making the trip, taking the time, sharing your expertise. I will say that when we were putting this conference together, your name came up immediately, and we must get Jackie here. So I get it. I get it. I was really privileged to hear your story, and thank you for sharing that. I know for us, and one of the reasons that I was really excited about this is we were talking earlier. I grew up first generation, and I know for me, my family uses turmeric as a traditional healing for things, and as a somewhat arrogant little mini scientist, I said, Mom, like, this can't be a thing. You can't put turmeric for every solution. If that was the case, then everyone would be using this in medicine just because it wasn't in PubMed. And now, of course, somebody published on it and everybody's got golden milk and turmeric for this. And I'm like, sorry, Mom, you were right. And so I think for us, it's about figuring out, we have this evidence-based kind of charge, and how do we bring in Western science and traditional knowledge. That really resonated for me. Thank you. It was powerful. We're very fortunate to be guided by our tribal working group in the work that we do, and we just want to continue to advance that. So thank you so much. Really appreciate it.